I always talk about how the vast majority of first aid kits on the market are complete garbage. So today we're going to go over what goes in a good first aid kit in case you want to make one on your own or are looking to buy one. Start off with just band-aids, get the branded stuff because they stay on longer. And a lot of people say you don't need band-aids, they're not necessary, but even small cuts can become infected, so it's good to cover those up. Next is a very important life-saving piece of gear, and that's a tourniquet. You use that when there's severe bleeding from an arm or a leg, where the blood is spurting or pooling fast. If you don't treat a severe injury that's bleeding really fast like that, you could die within 2 to 5 minutes. And there's a high chance that even if you are able to call 911, the ambulance and the firefighters won't get there that quickly. So it's very important to have a tourniquet. Make sure you get a real tourniquet though, not the cheap stuff from overseas. Get a North American Rescue Cat tourniquet, get a soft T tourniquet, or a rat's tourniquet. Next is an emergency pressure bandage. You also use this when someone is bleeding, but you use this when a tourniquet is not necessary, meaning there's not a lot of blood, or the tourniquet cannot be used at a spot like the neck or the groin or the head. Next is compressed gauze or regular bandage gauze rolls. Make sure you have a lot of these. You can use gauze to pack deep wounds to absorb blood, then apply pressure to the wound. Make sure you have medical tape as well. Hemostatic gauze like Quick Clot is great as well. Quick Clot is a gauze that's infused with a clotting agent. It helps your blood clot faster at the source. You use this when someone is bleeding heavily, maybe a gunshot, stabbing, or shrapnel. Next is chest seals for sucking chest wounds. If there's a hole in the chest or the upper back from something like a gunshot wound or a stab, and the person is struggling to breathe, use a chest seal. You'll usually hear a hissing sound as the person breathes in, and the wound will probably be bubbling with air and blood. Next is trauma shears or medical shears. You use these when you quickly want to cut someone's clothing off to get to the wound and treat it. If someone's on the ground and they have a stomach or a chest injury, you don't want to pull their head forward and then try to pull their shirt off. Maybe you could make them bleed out more, they could have a spinal injury that you made worse, so it's better to just take the shears and just cut their shirt open. Also with leg injuries, you're not going to pull their pants down. You're going to take the shears and cut through the pants and then get to the spot that you need to treat. Because the other thing with even moving their leg is they could have a broken leg. You might just see one injury on the surface, but they could also have a broken leg that you just made worse. Get a SAM splint. Use that to immobilize an injured limb. Get an antiseptic like povidone iodine. It's powerful, it's broad spectrum, and is good for deeper wounds. It'll kill bacteria, viruses, and fungi. A lot of people don't know this, but rubbing alcohol can actually damage healthy tissue and slow down healing. Get triple antibiotic ointment. It helps prevent infection in cuts, scrapes, burns, and other small wounds. Next is a tweezer. They're useful for removing debris from wounds. Next is nitrile gloves, at least 4 to 6 pairs per kit. You don't want to go digging around in someone's wound with your bare hands. Gloves protect you from their blood and it protects them from getting an infection.